Hello, and welcome to episode 23 of the Brain Cancer Podcast. Before we get going today, I wanted to just give you all an update about my recent MRI results. I just got off the Zoom call with my doctor maybe 10 minutes ago before I sat down again to start recording this. Everything looks great. Everything is stable, no changes, and there has been no significant interval change in appearance of the right frontal resection cavity without evidence of recurrent or progressive tumor. That is about all that I can ask for at this point, and my next scan will be in 2 more months, so that would be mid-March. I can't believe it is already almost the end of January here. It's flying by. What I want to talk about in this episode is something that I have discussed in the past, but I felt it was in need of an update, if you will. I just wanted to talk about 2 years that we have all been through with this pandemic, combined with being a brain cancer patient. Cancer does not care about a pandemic. It's just going to keep doing its thing. Many hospitals had no visitor policies for quite a while, where you might be waking up from your first, second, third surgery and you have nobody there as a support person. For my second surgery back in May, I knew that I was going to be out the next day anyways, so I felt completely fine just going in the morning, getting my surgery, waking up, going through my usual post-surgery taking of meds and trying to get up, walk around, do all of the things that I would have to show that I was able to do to be able to be released the next day. And that is exactly how it went. I feel very fortunate that I was able to bounce back so well and that this was just a minor brain surgery. My tumor location also really helped because it was right frontal lobe and not in a very difficult to reach place. Also, it was the same surgeon, and he was already well familiar with my case. It's become more well known now that due to people isolating, staying at home, and not socializing as much, our mental health has definitely taken a hit. As if things weren't already bad enough, now we have to go through surgery, chemo, radiation, clinical trials in a hospital where we aren't allowed to have visitors. I think this policy has been lifted at most places by now, but it was something that was definitely very real during the peak, I guess you could say, last year when hospitals were pulling people from different areas to come help work in the COVID centers or pulling people from other departments to departments that they weren't very familiar with. It can be very easy to get stuck inside of your own head after you're diagnosed with any brain tumor. I know that we all have family, caregivers, friends who are all trying to be as supportive as they can. And for that, we are so thankful because there's a lot of things that we might not be able to do on our own for a while after surgery or possibly for longer periods of time. And it's this feeling that you can't do things, which really starts to eat at us. In addition to taking care of our actual body, we need to take care of our mental health as well. I know I had already done an episode on mental health, but I wanted to bring this back up because I've been hearing a lot of stories about how people have been faring during these past 2 years while they're going through their treatments. I think one of the most important things that we can be doing right now is, if we aren't already, looking for a therapist, especially a therapist who is familiar with treating trauma or cancer, who can help pull some of these difficult thoughts that we might have and help us just explore what's been going on in our heads. It might take you a couple therapists to find the one that works for you, and that is completely normal. I found mine on Psychology Today on their search page. I had initially gotten a referral to one who was at MGH as well, but I think the one that I have had for 3, 4 years, however long it's been, she has been amazing, just not for all of my brain cancer related issues, but just life in general. We all have a lot more issues that go far beyond brain cancer, and it's always good to be able to have a neutral third party that can help guide you through exploring some of your feelings. This disease can put a lot of strain on relationships as well. In addition to having your own therapist, it may be beneficial for you to have some sort of couples therapist that allows you to each say how you're feeling without fear of making the other person angry or upset, because the therapist in the middle can act as an arbiter of sorts. I know there used to be this stigma about therapy, and you would go and lie on the couch and they'd be there with the pen writing down things, but it's not like that. When we were doing in-person visits, it was just me sitting on a couch and her just sitting in a chair, and we just talked. And that's what we did until we switched over to virtual visits due to the pandemic. In a way, this has made it even easier for anybody to find a therapist and get the help that they might need from the comfort of their own home. There's no more sitting in the waiting room at some awkward office or anything like that. You can be at your desk right in your apartment, and there's no reason to feel ashamed about it, but if you don't want to tell anybody, that is up to you. I just prefer to talk about how much it has helped me in my life in general. We all have different anxieties about different things, and it's been a great help. I think there are a few other things that you could be doing aside from seeing a regular therapist. You can use some of the modern tools that we have now, as well as a good old pencil or pen and paper. You can go to a bookstore, and I would recommend doing this with a pen and a paper. Go to a bookstore and get a journal or a notebook, whatever you want it to be. And you can write down how you're feeling every day or every other day, or just whatever you really want. If it's something that's important to you, or you just want to make note of how you're feeling that day and how you hope to feel tomorrow, it's going to be whatever works best for you. You never have to be too formal about it. It's all what you want to do. Another thing that you can do is, whether it's through your phone or your webcam, is make audio recordings. There are plenty of voice recording apps that you can download. And if you don't want to use a pen and paper, you can just make audio recordings of yourself and just basically just say how you're feeling, and then you can review them in the future. You can do the same thing essentially with video as well, because then you have the video and the audio. But sometimes it might just be quicker to pull out your phone, say a few things, and continue moving on with your day. I think what my goal is, it's to just let you all know that sometimes we're on medications that might make us feel angry or depressed, tired, or any other number of negative side effects. A lot of the side effects of the drugs that we're on can be very, very frustrating. Thankfully, many of them aren't temporary. I do try and stay very active and eat well also. After my first surgery, there's always a portion of you that will always have that little bit of fatigue still. I do try and get outside and be as active as I can. And I think it's even more important during these cold winter months to make sure that you're eating well and taking a vitamin D supplement, because we have a lot less sunlight up here in Boston at this time of year. But The days are getting longer, and soon we will be springing ahead again, and we will have those sunsets closer to 8:30 or 9 o'clock up here. Seasonal affective disorder definitely affects different people differently. If you already have a history of seasonal affective disorder, throwing a brain cancer diagnosis on top of that is going to make things more and more difficult. I understand that. I think I'm still one of the few people that, even up here, really enjoys winter a lot because I see it as just another part of the cycle. We can't have all of the amazing flowers and all of the spring colors and the grass coming back without winter. And then we can't have the amazing falls that we have without the leaves in the summer. Winter is just kind of it's a little break because we all need a break at some point, and there's nothing wrong with that. It's completely normal. It is easy to get trapped in our own heads. I've been there, and it took me months after my diagnosis to kind of grasp how things are and come to terms with my diagnosis. And we're all going to do this at different rates depending on our own personalities. I kind of wanted to keep things quiet until I could research and fully understand what was going on with me. And once I came to accept that and moving forward in my treatment, it really changed how I look at things, not just cancer, but just life in general. You never expect it when you're in your 20s or in your 30s or in your 40s to be diagnosed with a brain tumor. Most of the symptoms that we see are just attributable to something else, whether it's the common cold or allergies or a sinus infection, ear infection, whatever it may be. And far too often, it's only until we have some sort of breakthrough event that we end up finding out what's going on. And it's like a torrent of emotions. It's really difficult to explain, especially to people that have never been there. But it really is something that completely changes your look on life and what you want to do going forward. While it's easy to get stuck up in looking on statistics for something like glioblastoma, and you see 12 to 18 months is what you have, those statistics, they're just statistics. We are in the middle of a cancer revolution right now where there are far more options than we ever had in the past. Those same statistics haven't really caught up with the treatments that we have available. It's only been 15 years since the introduction of temozolomide. I have met plenty of people that were 20 years plus that were out from a glioblastoma diagnosis. We are learning more about the different mutations, especially the IDH1 mutation and the importance of your MGMT methylation status and a couple other key mutations that really can guide your overall prognosis and the best options for treatment ahead. The days of, well, you get surgery, radiation, and that's it, those are long gone. We have temozolomide now, so you can have surgery, radiation, and the chemo. In the past few years, though, 5, 10 years, because of how complicated our brains are, with the blood-brain barrier, it blocks off many, many potentially beneficial treatments. It becomes a barrier to treatment and effectively serves to protect what we don't want growing in there. I'm sorry if I'm going off on a bit of a tangent, but I really wanted to stress that, especially over the past 2 years, the population in general, our mental health care is falling rapidly. And we see this in more and more younger people, even school age children. And this is something that we have to address. I think I just wanted to point out how important it is to realize that while nobody will ever feel exactly what we do inside of our heads and what we're going through, that doesn't mean that we can't share it or express ourselves to other people that are trying to help us. You can do it any way you want. For me personally, I've been seeing my therapist for years now, and starting this podcast was essentially me wanting to share my own audio recordings with you all. I have a few random old recordings on one of my phones, but it was just how I was feeling at the day. Then I decided that I wanted to start doing this, and I encourage everybody to do something for themselves that allows them to, express yourself. Put it down so that you can look back in a year and see how far you've come. And I know that I've been kind of talking to us inside of our heads as brain cancer patients, but this is just as important for any caregiver or loved one who's also sharing the same experiences. Another great thing that you can do, we have support groups, and the American Brain Tumor Association has their mentor program where you will get matched up with somebody that has the same diagnosis as you, and you can communicate with them however you want, once a week, once every 2 weeks, daily, email, phone calls, whatever works best for you. The mentor program for the ABTA is a great resource, as well as some of the groups on Facebook. I know that there are glioblastoma specific groups and brain cancer specific groups. I don't know exactly when we will have in-person support groups because we're still in the hopefully waning phases of this COVID saga, I guess you could call it. But I just wanted to make a quick episode about this. I know it's not the kind that's filled with facts and stats and things that I really like to study and share, but this is something that is a personal topic for each of us. Everybody's going to want and need specific avenues of their own self-care. In closing, I just want to say you should never feel ashamed about reaching out and doing things simply on your own to help get your feelings out, because they will start to eat at you. And this is already a difficult enough experience that we have resources available to help us. And if you still aren't sure, don't be afraid to ask for help, especially when you're going through a difficult time like this. Nobody is going to judge you. I just believe that it is our duty to take care of ourselves just as much as we would want to take care of any of our loved ones who are going through a similar situation. I just had to pause the recording because it seems like the utility trucks are back to work, and they were on break while we had all the snow, but the snow's gone, and I guess they're still trying to finish up in the area because they're at the end of the street now, but they have to drive down past where I'm at. So I've been trying to record around their constant trucks. But I'm going to leave that here. And I want to thank you all so much for taking the time out of your day to listen to me. This is a topic that I'd wanted to cover, and because I just had my doctor's visit, I wanted to just keep talking. Like that's pretty much what it was. I wanted to make an episode like this, and I hope that I can just help someone. If you want to contact me, you can email me at any time at braincancerpodcast@gmail.com. You can like the page on Facebook at facebook.com/braincancerpodcast. You can always feel free to send me a message on there as well. That's literally the only reason why I still have a Facebook, is for our show. You can follow on Twitter at braincancerpod. And make sure that you like or follow or subscribe to the podcast on whatever platform you're listening from, whether it's Spotify, Apple Music, Google Podcasts, whatever it may be. Make sure that you give it a like and a follow. Just know that you can always reach out to me. I think that's about it. Thank you all so much for listening. I hope you all have a great day or night, and I will talk to you again soon. Bye.